Sexually transmitted infections, STIs, continue to affect millions of people worldwide, cutting across age, gender, social status, and geographic boundaries. While some STIs are widely discussed in public health campaigns, others remain poorly understood despite their serious health consequences. Lymphogranuloma venereum, commonly known as LGV, is one such infection. Lymphogranuloma venereum is a chronic, invasive sexually transmitted disease caused by specific strains of the bacterium Chlamydia trachomatis. Unlike more common chlamydial infections, LGV is more aggressive and primarily affects the lymphatic system, leading to inflammation, swelling, and long-term complications if not treated promptly. Although LGV is considered relatively rare in many parts of the world, it remains endemic in several regions and has reemerged in recent decades in certain populations. Because early symptoms are often mild or unnoticed, many people remain unaware they are infected, allowing the disease to progress and spread. This video aims to provide a detailed, scientifically accurate, and easy-to-understand explanation of lymphogranuloma venereum. We will explore its history, causative organism, modes of transmission, clinical stages, diagnosis, treatment, prevention strategies, global distribution, and public health importance. If you appreciate in-depth health education like this, make sure to subscribe to the WUTNews YouTube channel for more informative and awareness-driven content. What is lymphogranuloma venereum, LGV? Lymphogranuloma venereum is a sexually transmitted infection caused by invasive serovars L1, L2, and L3 of the bacterium Chlamydia trachomatis. These strains differ from the more common chlamydia strains that cause uncomplicated genital infections. LGV primarily targets the lymphatic vessels and lymph nodes, leading to inflammation, swelling, and tissue damage. If left untreated, the infection can progress to cause chronic pain, scarring, genital deformities, and bowel complications, especially when the rectal area is involved. Historical background. The history of lymphogranuloma venereum dates back to the early 20th century. The disease was first recognized as a distinct clinical entity in 1913 when physicians observed patients with genital ulcers followed by painful swelling of lymph nodes in the groin. Initially, LGV was confused with other ulcerative sexually transmitted diseases, such as syphilis and chancroid. In the 1930s and 1940s, advances in microbiology led to the identification of Chlamydia trachomatis as the causative organism. Before the widespread availability of antibiotics, LGV often resulted in severe complications and permanent disability. With the introduction of effective antimicrobial therapy in the mid-20th century, the incidence declined significantly in developed countries. However, LGV has never been eradicated and continues to pose a public health challenge. The causative agent, Chlamydia trachomatis. Chlamydia trachomatis is a gram-negative, obligate intracellular bacterium, meaning it can only survive and replicate inside human cells. The bacterium has multiple strains, classified into different serovars. Serovars A through C cause trachoma, eye infection. Serovars D through K cause common chlamydia genitals. Serovars L1, L2, and L3 cause lymphogranuloma venereum. LGV strains are more invasive and capable of spreading beyond the initial site of infection into the lymphatic system, which explains the more severe clinical course. How LGV is transmitted. Lymphogranuloma venereum is transmitted primarily through sexual contact, including vaginal intercourse, anal intercourse, oral genital contact, less common. Transmission occurs when the bacteria enters the body through small breaks in the skin or mucous membranes. The infection is more likely to spread during unprotected sexual activity. Although LGV is not as easily transmitted as some other STIs, close and repeated sexual contact increases the risk. The disease is not spread through casual contact, such as hugging, sharing toilets, or shaking hands. Incubation period. The incubation period for LGV typically ranges from 3 to 30 days, but symptoms may be subtle or absent in the early stages. This delay contributes to unintentional transmission and late diagnosis. Clinical stages of LGV. LGV usually progresses through 3 distinct stages if left untreated. Stage 1, primary stage. Small, painless ulcer or lesion at the site of infection. Lesion may heal quickly and go unnoticed. No significant discomfort. Because the initial lesion is often mild and transient, many individuals do not seek medical care at this stage. Stage 2, secondary stage. This stage typically develops weeks to months after initial infection. Painful swelling of lymph nodes, especially in the groin. Formation of inflamed lymph nodes, buboes. Fever, fatigue, headache, and muscle aches. Inflammation may cause abscess formation. At this stage, symptoms become more noticeable, prompting many individuals to seek medical attention. Stage 3, tertiary or late stage. If untreated, LGV can progress to chronic disease.
severe inflammation and scarring, genital swelling and deformities, rectal inflammation, bleeding, and strictures, chronic pain and bowel complications. Late-stage LGV can cause permanent damage and significantly reduce quality of life. Diagnosis. Diagnosis of LGV involves a combination of clinical evaluation and medical history, laboratory testing for Chlamydia trachomatis, molecular tests such as nucleic acid amplification tests, NATs, serological testing in some cases. Because LGV symptoms can mimic other conditions, accurate diagnosis requires specialized testing and clinical expertise. Treatment options. Lymphogranuloma Venereum is curable with appropriate antibiotic therapy. Common treatments include doxycycline for an extended duration, alternative antibiotics for those who cannot tolerate doxycycline. Treatment usually lasts at least 21 days to ensure complete eradication of the infection. Early treatment leads to full recovery, while delayed treatment may not reverse existing tissue damage. Prevention strategies. Preventing LGV involves many of the same strategies used to prevent other STIs. Consistent and correct use of condoms, reducing the number of sexual partners, regular STI screening, early treatment of infected individuals, avoiding sexual contact during active infection. Public awareness and education are essential components of prevention. Global distribution. LGV is most commonly reported in parts of Africa, Southeast Asia, India, Caribbean countries, South America. In recent years, outbreaks have also been reported in Europe, North America, and Australia, particularly in urban centers. Public health importance. Although relatively rare, LGV is important from a public health perspective because it increases the risk of HIV transmission. It causes severe complications if untreated. It is often underdiagnosed. It contributes to long-term disability. Early detection and education are key to controlling the disease. Living with and recovering from LGV. With timely diagnosis and proper treatment, most individuals recover fully. Symptoms resolve completely. Long-term complications can be avoided. Follow-up medical care is essential to ensure complete healing. Myths and misconceptions. LGV is not caused by poor hygiene. LGV is not limited to one gender. LGV is not a punishment or moral issue. LGV can be treated and cured. Breaking stigma is crucial for encouraging people to seek care. The role of awareness and education. Awareness saves lives. Understanding how infections like LGV spread, how they present, and how they can be treated empowers individuals to make informed decisions about their health. Educational platforms like YouTube play a crucial role in reaching wider audiences with accurate, stigma-free information. Final message. Lymphogranuloma venereum is a serious but preventable and curable sexually transmitted infection. Early recognition, prompt treatment, and responsible sexual behavior can stop its spread and prevent long-term harm. For more trusted, educational, and awareness-driven health content, subscribe to the WUTNews YouTube channel today. Stay informed, protect your health, and help spread knowledge that saves lives.